What's up, peeps?
Hey, everybody.
Welcome to Blunt and Biased.
I told somebody about our topic and he was like, oh, that's really cool. And I was like, yeah.
Awesome.
Yeah.
Yeah, some people really dig the vitamin D topic, and some people are just like, wait, what? Why is this an issue?
Mm-hmm.
The reason I think it's an issue is because I've heard for the last, I don't know, I'm going to say 5 years,
Mm-hmm.
the majority of people are low in vitamin D. And so I'll hear just random people being like, you should take a vitamin D supplement. And people are just more than happy to be like, okay, because they hear vitamin and they don't think that there could be side effects to a vitamin or to having too much of a vitamin. And if you look at a lot of vitamins, right, you'll see like 1000% of the daily recommendation, and people are like, awesome, like more is better, and it isn't always better. So vitamin D specifically, I'm like, this is really important. And the fact that last time you had mentioned it also acts as a hormone, I think a lot of people aren't familiar with that concept as well. So for everybody just joining us, I am Theresa Paganini. I own Love Yourself Lean. I am a weight management specialist, and I help people focus on what I call, well, I would focus on the 4 M's because Dr. Katie is in charge of some of that. But together we focus on the 4 M's, the mind, the mouth, the movement, and the medical. And all 4 of those really impact your ability to lose weight safely, successfully, and long-term. And so my big push is the mind and the mouth. Dr. Katie's is the medical. And then we both kind of talk through the movement side and also help refer to those professionals that work on that. So that's my spit. What about you, Dr. Katie?
Yeah. Hey, everybody. Dr. Katie Schneller. I own Inclusive Natural Medicine. I'm over here in Tempe, Arizona. Sometimes when you put it into Google, it says Chandler, and I'm on the outskirts of Ahwatukee. So I'm in a nice little trifecta area. They're doing some work outside. You might see today if you're watching. So pardon the distraction. But I focus a lot on gut health and a lot of autoimmune. But just in general, the types of people that come to see me as my patients are people that have seen a number of specialists or have other diagnoses, and they're not feeling better and they're not feeling heard. Nobody's figured out what's wrong or gotten to the root cause. And that's my job as a naturopathic doctor, to get to the root cause of what's wrong with somebody. So, or how, to get to the cause of how you're feeling and why it's not normal. So today, our topic is on vitamin D. And really, there's so many different things we can talk about. I think even before we jump in on the topic, I'd just like to give the little caveat that I normally do, which is please stop taking medical advice from Facebook and from your cousin or your sister or somebody in your family unless they have a degree, especially in supplements. A lot of docs and other types of providers don't have the proper education on supplements, on vitamins, on nutrients, especially on herbal medicine. And just because it's natural does not mean it's safe, and more is not always better. Please, if you do anything, schedule a consultation with somebody and get your supplements checked and make sure that if you're on medications, those aren't interacting with the other things that people are recommending to you to take. Or if you've taken your supplement regimen into your own hands and done your own research, that's beautiful and fantastic. And you more than likely probably need a little bit of help just to make sure what you're doing is not only safe, but effective. So that's my little biased perspective on being your own doctor. Yep.
Yeah. And a lot of this came from last time we did our talk. It was on vitamins, and the vitamin D is just such a big one because it is not water soluble. And Dr. Katie will talk a little bit more about why that's important to know. It does act like a hormone. We do actually produce it ourselves. We're a lot like a plant. We kind of create our own little photosynthesis with the sun and develop it ourselves. And there's sometimes absorption issues. So you could be taking D all day long and nothing's happening and it's not improving. So like, there's a whole lot of things around D. It's kind of one of the more complex ones. And so it deserves its own day in the sun. Haha. Sun. I'm such a kid. So I'm going to pass it to Dr. Katie.
Yeah, let's see. Let's start with kind of the difference between a water soluble and a fat soluble vitamin. We're not going to get super into this in detail. What I want you to take away from the difference between fat and water soluble vitamins is that the fat soluble ones mean they will quite literally build up in your system and can cause toxic effects. Those 4 vitamins are vitamin A, vitamin D, vitamin E, and vitamin K. You cannot and should not take those of your own accord for a very long time, because if your levels build up, there are toxicity symptoms and other disease processes that can manifest from toxic levels of vitamins. Your water-soluble vitamins are the ones that you tend to hear about the most outside of vitamin D, right? So we're talking B. People just say B vitamin. B12 is really one of the most common. There's also B1 and B2 and B3 and B4 and B5 and B6 and B7, right? B9. Those ones you have to take for extended periods of time in ultra high doses in order to develop your toxicity effects. So for the most part, taking things like B12 can be significantly safer than taking vitamin D. Having said that, still, right, always the best thing to do is to get your blood levels checked of these vitamins and identify whether you have a deficiency or an excess of any type of vitamin. So to review, fat-soluble vitamins you cannot take long-term without monitoring. You will build those up in your body, causing toxic effects, and those vitamins are vitamin A, D, E, and K. Those are the 4 that you want to be, the most kind of concerned with. And I think really people started abusing vitamin D when COVID happened, because everybody knows of vitamin D as an immune support, or at least a lot of people did or started to learn about vitamin D as an immune supportive vitamin. And it's fantastic. It helps regulate the immune system and boost the immune system's effects and ability to fight things off, including viruses. However, like we just talked about, you cannot take it long-term just forever. There's not really necessarily a safe dose to be on unless you're being monitored.
So just real quick, right? Like, 'cause back in the day, vitamin C was like the major vitamin when you were sick, right?
Yeah.
And people, you could just pop some vitamin C's all day long, and whatever your body doesn't need, you just pee out. So like there's that safety or feeling of safety with vitamin C where you're just, whatever. You can't get too much of it, because if you don't use it, you pee it out. Like that's like a common thing most people know. Yeah. And so then all of a sudden you hear vitamin D is great for immune, and people don't understand C being water soluble, D being fat soluble. They are stored differently in the body, where you can just pee out excess of one. You will not do that with the other. And I think that's why this became such a big deal, because comparing D and C as both immune support, they both help,
right?
But they do act differently, and so you can't just pop D the way you do pop C.
Right. Yeah. And with vitamin C too, I mean, just to get off on a little mini tangent, you will get loose stool effects if you're taking too much vitamin C. So if you're somebody who struggles with diarrhea, take a look at how much vitamin C you're getting every day. Just kind of a side note there. So
gloom and doom with everything. Dang it.
Yeah, right. Doom and gloom. Yeah, you can't do anything right. So with vitamin D, us being plants, right, as humans, like photosynthesis that you mentioned earlier, a lot of bodies nowadays are struggling more and more to convert the form of vitamin D that comes from the sun into the usable form that our body needs as vitamin D3. So if you're somebody who's like, I'm really probably not vitamin D deficient, I spend all day in the sun, or I live in Arizona. Number one, if you're in the sun all the time, your body might not convert it very well. And number two, if you do live in Arizona, you're probably inside a lot because it's really hot. So we're not getting a lot of vitamin D. I would say probably close to 95% of my patients that present to me have vitamin D deficiency. Before we move on from there, and then I'll pause and let you, say something or have help me kind of guide the conversation. Vitamin D deficiency includes anything from my standards, from a naturopathic doctor's standards, at about 50 and below. Most reference ranges say somewhere between 30 and 100. Some will even go as low as 20, I've seen. But optimal vitamin D levels consistently across the board is between 60 and 80 on that blood work. So if you're at 32 and your doctor told you were fine, yes, you're not clinically low, but you are quite suboptimal. You essentially want to at least double your vitamin D levels. And how you do that is, again, monitored through a doc. You can't just take your own vitamin D. You need help with dosage. Some docs do it differently too. You can get one ultra high dose and kind of do little monitoring doses after that. Some people do 5,000 IUs a day. Some people do 1,000 IUs a day, really kind of bringing it back to the same point, which is that you need a doc to monitor. But we are not getting a lot of vitamin D from the sun anymore, is kind of my whole point with that one.
I don't really have anything to add. I think you hit on that, right? Because I think a lot of people are just like, hey, I live in a really sunny state. Okay, but how often are you actually in the sun?
Right.
And just because you're in the sun, is your body absorbing what it needs to absorb or not? Like there's so many things that have changed. And I also think there's just so much more knowledge that we've got that we just didn't have before. Where it's a little bit more complicated now. We don't spend the time outside that we used to.
Right.
Yeah.
And another kind of tidbit for absorption too, the type of vitamin D that I tend to recommend to my patients is one paired with vitamin K1 or K2 or both. The reason is if you take vitamin D unopposed, especially if you're getting injected vitamin D, and sometimes those doses are quite high, without the pairing with K1 and K2, you actually have more of a propensity to develop kidney stones. So if you're somebody who's just on a plain old vitamin D, not necessarily anything wrong with that. However, if you're somebody who's had kidney issues in the past, or you're someone who's developed kidney stones, you definitely want your vitamin D to be paired with K1 and K2. And in general, right, if you're going to take a vitamin, let's make it the most effective that we can. So taking a look at your label and identifying whether there's a little bit of K in there can be helpful. If you're someone, for example, who's been shown to be vitamin D deficient in the past and you've been taking vitamin D and your levels aren't really changing a whole lot, you might just need some help with some absorption.
So real quick, I'm going to jump in there and say, okay, so I am just the everyday Jane, and what symptoms should I be looking for that would make me come to you to say, I'm curious if I have a vitamin D deficiency? Like if I feel fine, do I really need to just go like, let me go make an appointment with my naturopath and just see if I'm deficient? Like what should I be looking for?
So just a few really simple things. Fatigue is sometimes one of the easiest reasons that people are feeling tired, is just that they're low on vitamin D. Vitamin D plays a large role in our energy, mental and physical energy. If you are having difficulty sleeping, especially falling or staying asleep, then that could be a vitamin D deficiency. As I've mentioned in our last podcast, it is essentially a hormone, right? We're already talking about it regulating your energy levels, your sleep levels. It also is important in mood stability. So if you find that you're someone who's kind of like moody or extra irritable, feeling really overwhelmed kind of easily, then that might be a vitamin D deficiency as well. So those are a few symptoms you might be experiencing. If you're anyone who has had any trouble with bone growth or bone pain or any kind of degenerative anything there, check your vitamin D levels and your calcium levels. And then if you're somebody who has low thyroid, which is really, really common, if you happen to have the version of low thyroid that has positive antibodies, which means you're autoimmune thyroid, right? So I'm talking to my Hashimoto's people here. Optimizing your vitamin D between 60 and 80 does actually play a large role in getting your body's antibody numbers down. So in that situation, the symptoms that improve are those of low thyroid function, which is autoimmune related. So sick often, potentially, cold, or feeling cold or an intolerance to extra levels of cold, fatigue, constipation, brittle nails, thinning or losing hair. Those are some symptoms of Hashimoto's. And so if you can't get your antibodies down, make sure your doctor's checking out your vitamin D levels too. And those are just a few.
We're going to set up an appointment for me to get my vitamin D checked. I used to be on vitamin D and then I got too high, so I stopped. But now I'm like, wow, I have like every symptom you're just talking about. So that's hysterical. All
best.
right, so those are symptoms that would help you understand if, like, potentially you have low vitamin D, and therefore then go see a Dr. Katie, if not Dr. Katie. Now let's talk about vitamin D as a hormone. I feel like that's newer knowledge that people haven't heard as commonly.
Yeah.
So talk about that a little bit. How can a vitamin be a hormone?
Yeah. So when I say it's essentially a hormone, what I mean is that because of its large role in so many different things throughout the body, it is considered to be as important as a hormone. So it's not that it necessarily is, it will always be a vitamin, it's a vitamin, but it is so important in so many different places. Like we just talked about, yes, it'll help regulate your energy, your sleep, your mood, your Hashimoto's, but also optimizing your vitamin D to that 60 to 80 does other things like reduce your risk for heart disease, reduce high blood pressure, reduce your risk for diabetes and infections. And then also, of course, as we mentioned, regulate the immune system. So it helps with any kind of immune system disorder and prevents some types of cancers. So, that's really what I mean when I say that. It's not that it'll it's considered a hormone, but it's still a vitamin.
Okay, so it's a vitamin that just happens to have very similar
Roles as a hormone.
roles
Yes,
as a
yes,
hormone.
yes.
Yeah, so it's not like a vitamin D will impact your estrogen, testosterone, cortisol, insulin, like any of those kind of hormones. It's not going to affect those per se,
Um,
or does it?
well, it can, yeah. So it can have some direct effects like that, but it's more of just it's a key player, shall we say, in some of those things. It's not that, vitamin D causes norepinephrine to raise or lower, things like that. Nothing like that. But
Gotcha.
it plays an important role in regulating a lot of different things through various biochemical pathways.
So knowing all this about vitamin D and knowing there are different ways for a doctor to prescribe it,
Mhm.
what would cause one doctor to prescribe a high dose shot of it versus another that um, recommends an actual oral supplement of it
Mhm.
versus? Like, why would one be better or not better than the other?
Yeah, I think mostly people that are getting the injectable form of vitamin D are people that have some level of malabsorption or like a pretty significant amount of malabsorption. And by that I mean in your gut when you're taking supplements or you eat food, your body does not really break down and absorb what it's supposed to and keep out what it's supposed to. Things like toxins and allergens and microbes. If you're somebody who's ever been diagnosed with leaky gut, that kind of thing, celiac, Crohn's disease, any kind of irritable bowel syndrome or disease. If you have those types of things, your doctor might give you the shot just to make sure that your vitamin D levels are raising, because if you're taking supplements and your body already doesn't do a good job absorbing what you take orally, then they may just inject it for you. Of course, that has to be safe, and hopefully people are getting that who don't have a propensity for kidney stones, because again, it won't be paired with K1 or K2.
So generally, if you go for the injectable version, it is not paired with the Ks.
Correct. Yeah, I don't know of a compounding pharmacy that does do that. Maybe there is one. Hopefully there is, but for the most part, when you get that into your office as a provider, it's just plain old vitamin D3.
Gotcha.
Mhm.
And then if you start, and a doctor will, once you start working with a doctor, they're going to answer all these questions. But I feel like I'll just get Dr. Katie to answer all of it now. So if you start working with a doctor on vitamin D supplementation, how often should you check to ensure that you then don't go beyond, like that you stay within that 60 to 80 range?
Yeah. I mean, you can check as many times as you want to double check. I tend to do somewhere between 3 to 6 months, depending on either whether the patient was really elevated in vitamin D or if they were really low. And we want to make sure that their levels are where we want them to be. It hopefully is not something that you have to take forever, but for the most part, people will just continue to kind of be low in vitamin D over time. I don't really know anyone. I don't think I've seen a single patient who has adequate levels of vitamin D and isn't on it.
Got it.
So, yeah.
So it sounds like if you're low, the potential that you'll stay low is pretty high. The
Relative.
amount of vitamin D you may need may vary. You may need some extra higher dosing in the beginning to get you stabilized, and then go to a lower dose to keep you stabilized, is what I'm hearing.
Yeah.
But if you test every 3 to 6 months, you'll be able to ensure that you are on the proper dosing for where you need to be.
Right, right. And once you get it down well enough, maybe you've had a couple of 6-month checkups and you're doing well at that particular amount of vitamin D, or your stores are enough so that, your levels remain where they need to be, then you may only need vitamin D, once a year or something like that. But for the most part, I've got, quite a number of patients that are just on a daily low dose vitamin D. And if they're lower, then sort of similar thing. I do give them kind of a loading dose, so to speak. So it'll be a bigger dose at first to try to get their stores up faster, so that we're not waiting weeks and weeks for their vitamin D to be up to notice whether they're going to feel different or not.
Yeah. So really quickly, because we have the time, right? We've got the ADEC, the 4 fat soluble vitamins. D is the one we've been talking a lot about, its importance. Are the A, E, and K as significant as the D? Where
I would say not. For the most part. I mean, vitamin A has some support for the immune system. It's part of my acne protocol. It's helpful for a lot of different things, but not as many as vitamin D. And then E is kind of just one of those same thing, like can help with the immune system, helpful for a few other kind of specific conditions, but not so much overlap like vitamin D has. And then K really is just with clotting. It's kind of all that its role is. So yeah, I would say vitamin D is definitely the head honcho of the fat soluble vitamins.
Awesome.
Yeah.
So any final thoughts? I don't think it'll be a bad thing if we don't hit our full 30 minutes. It's okay.
Yeah.
But
Yeah,
we don't have any viewers right now to ask questions. If you do have questions, if you come to watch this later, once again, Dr. Katie and I both do get notifications that we've got some comments and questions on there, so we can always answer those. But any final thoughts on vitamin D that you want people to walk away with?
I think maybe just if you're not sure, or if you've been somebody taking vitamin D for a long time, or if you haven't, if you're anywhere on the spectrum, you have no vitamin D, you've never taken it, or you've been taking vitamin D for a long time, get your blood levels drawn and just identify where you're at. Keep in mind that there are some conditions that predispose you to have low vitamin D. We've talked about Hashimoto's thyroiditis. PCOS is one of those as well. And then if you're uncertain and you don't want to do a blood test, there's a site that can be kind of like a preview for you to identify what you may be low in. It's called Mytavin. It's mytavin.com. And what you do is you input all of your medications that you're on, if you're on any. And when you combine those into there, you literally just add them together, and then it'll kind of spit out a result for your most common deficiencies from that combination of medications. It doesn't do it for supplements, unfortunately, but supplements don't deplete vitamins. So,
and that was MI or MY?
MY.
Oh, whoops, I got that wrong. Let's see if can I delete my little comment?
Yeah, might have.
Yes, I can.
But I think that's it. As always, right? Like, talk to your healthcare provider about your particular condition. Nothing that Theresa or I ever say is specifically individualized advice to you. If you're ever looking for that, come to see us for that info. And we would be happy to kind of provide you anything that you need.
All right. And since it let me delete it on yours, it didn't let me delete it on mine.
Weird.
Put user in timeout. Well, that's me. Anyhow, so Dr. Katie, why don't you put in the chat the best way for people to reach you specifically to be able to start working with you to ensure their vitamin D levels are at the appropriate place, high or low. I think the giving them an easy way, whether it's your phone number, whether it's a appointment link, whatever it is, put that in the chat and allow help people out.
Yeah, give me a call. I do have a front desk girl now, which is super exciting. Her name is Grace. She's fantastic. So she'll be the one probably that you're speaking with, but you can just ask for a 15-minute consultation that's free if you want to talk about your particular case and let me know what you're looking for. And I'm happy to answer any questions about the process of appointments together. Alternatively, we can just chat about what it looks like to get your blood drawn in my office. Blood draws for vitamin D do go through insurance. So if you have insurance, we can use it. Yep.
Awesome. All right. Well, thanks as always for sharing that amazing brain of yours, Dr. Katie.
My pleasure.
Yay. All right, everybody. Once again, if you have questions, throw them out there. We'll get them answered. Otherwise, we will see you in 2 weeks.
See you in 2
We're
weeks.
out. Bye.